Good evening. Hello, I'm Dr. Erik Viirre. I'm the Associate Director of the Arthur C. Clarke Center for Human Imagination, and we are hosting this evening's event, Star Trek, the Qualcomm Tricorder XPRIZE, and the Future of Medicine. So we have a special opportunity this evening because we have our XPRIZE competition winners here in town this weekend, including the XPRIZE winner. So we're going to hear a little bit about how actual tricorders were thought about and designed and built. Now, 50 years ago in 1968, there was a lot of trouble in the United States. There was a lot of trouble in the world, but also amazing things happened. A rocket took people around the moon, and a TV series called Star Trek was in its third year, and the fans loved it so much they wanted to keep it going. It was one of the first fan-led efforts to keep a TV series on the show. Also, 50 years ago was the founding of the UCSD School of Medicine. A school of medicine that's so young that just the other day I went to a reception for one of the original lecturers who has lectured every year for 50 years and is still doing so well in his ratings, Dr. Steve Hilliard, that they've asked him to come back for more. So we're a very young school and a very young university, but by many accounts, perhaps the most successful university in the world founded after World War II. So it's a special privilege to be here at UCSD, and we have all kinds of exciting things going on this weekend that Dr. Brenner will tell us a little bit about. So who creates the future of medicine? Well, of course, people all over the world do, but we have special roles and special things that happen here at UCSD. Just 2 weeks ago, a brand new class of medicine was approved by the FDA for migraine headaches. Now, migraine is a special topic for me. I have thousands of patients who have migraines. And we have more hope that we will see the end of headaches. Now, the target of this new medicine is a peptide called CGRP. What it stands for doesn't really mean, is not that really important, but what is far more interesting and important is that CGRP was discovered at UCSD. In the next building, we have the Future of Medicine and the Future of Surgery Center, where we do surgical simulations with virtual reality to teach our medical students, and all kinds of exciting things. And as you know, gene editing is the possibility for editing out disease throughout humanity. So it's a special place to be here at UCSD. And in 2014, we were lucky enough, because of our MOXIE, to be able to host the Qualcomm Tricorder XPRIZE Test Program. And that's what you're going to hear about tonight, is this program that was brought here to the university, and we were able to carry out and see to its end and to its winner, who's going to be our featured speaker this evening. So to tell you a little bit more and welcome you from the School of Medicine, I'd like you to welcome Dr. David Brenner.
I want to acknowledge that this is not Erik's day job. Erik is actually a practicing neurologist, my colleague at UC San Diego, and he's the reason that we're all here at UC San Diego and not some less interesting place. So Erik, thank you so much. Besides this event, this is a special weekend at UC San Diego. We're graduating 132 new physicians. They had their award ceremony today, and the full graduation and cap and gown will be tomorrow. So it's a lot of pressure on you guys to try to develop new medicines and new approaches so that this next generation will be even better doctors than old doctors like Erik and I. I also want to acknowledge how much fun it's been over the last couple of years to work with the XPRIZE for the tricorder, and all the people and institutions contributed. The Altman Clinical and Translational Research Institute was where actual model patients were assessed. The Center for Future Surgeries was where several of the ideas and the devices were worked upon. And we actually learned a lot from this. And when we opened a new hospital at Jacobs Medical Center, it was the first hospital where every patient had their own iPad. So everyone has access to all their own data, all their own test results, who's seeing them, who's their nurse, who's their doctor, and they can more actively engage, which I think is hopeful for the future of medicine. So without further ado, I want to get started. I'm amazed everyone's here on a Saturday evening. I don't know if that reflects well on us or that there's nothing else to do in San Diego, but it's really our honor to host you. But the person who's going to be our moderator is someone who's really well known in both XPRIZE and in Star Trek as Robert Picardo. He was the emergency medicine hologram in Star Trek. He is a big fan of science. He's on the board of Planetary Society. And a fun fact is that he and I were both classmates together at Yale. We were both pre-med. One of us played a doctor, and one of us became a doctor.
Thank you very much. Yes, this is. I was pre-med at Yale, and in fact was Erik's classmate. And I think I made, for me, the much better choice, becoming a television doctor. First of all, you don't have to actually know anything. That's always a plus, and you don't have to carry malpractice insurance. However, I think some actors should have to carry malpractice insurance. I've seen some pretty. Well, never mind. That's another topic. But helping human beings get well and stay well is one of the highest callings of humanity. A medical school trains doctors, and the hospitals in those schools have the latest and greatest technologies for medical care. Now, on a ship, whether you're on a starship or you're on a ship on the seas, resources are very different. You can't just order on Amazon for same-day delivery. For a doctor on a ship, you have to improvise, and you have to have access to equipment, and you may only have access to very small equipment. In Star Trek, there were two things that were small and critical for medical care: the tricorder and the AI that was played by me. The tricorder and the AI had two very important components: a smart sensor system to gather information and an empathetic, engaging, and ruggedly handsome human interface. Smart sensors and a human interface are the items to be tested in the Qualcomm Tricorder XPRIZE, the biggest medical prize in history. The XPRIZE competition designers were literally inspired by the Star Trek tricorder, and it turns out that the competition winner was as well. This evening, we will hear about the prize competition, how it started, and the inside story of testing actual patients with the tricorders, and from technologists who are building new data analysis systems and even new robots for healthcare. I don't like the name robot, by the way. I was a hologram. Data was a robot. He was hardware, I was software. Software is far more complex, okay? I said as much to Brent Spiner 2 days ago. He thinks I should get over it. Now, as I said, the technologists who are building new data analysis systems and even new robots for healthcare. And we might even later, if we have to, talk just a little bit more about Star Trek. To start things off, we have a very special guest, a fellow Philadelphian, Dr. Basil Harris, the leader of the Final Frontier, the team Final Frontier, that they are the winners of the Qualcomm Tricorder XPRIZE. Let's have a hand. Dr. Harris, why don't you just take the stage and take one of the seats here where I'll join you in just a moment. Dr. Harris is an emergency room physician in Philadelphia, as I said, and he literally brought his family together around the dining room table to create his team to build his dream, a working tricorder inspired by Star Trek. He was trained as an engineer and a medical doctor. This combination was absolutely necessary to build a tricorder. Dr. Harris went to Cornell and Drexel University for engineering and to Thomas Jefferson University for medicine. He, his family, and colleagues have founded Basil Leaf Technologies to bring their recipe for pesto. No, I'm kidding. To bring their tricorder technology from a prize winner to a must-have health care item in everybody's home. Ladies and gentlemen, if you will, Dr. Basil Harris.
Thank you. Switch over here. See if we can get this working. Thank you so much. Oh, thanks for the turnout. This is amazing to see everybody out here. UCSD has been absolutely incredible through this whole process. And so I want to tell you a little bit about taking medical tricorders from science fiction into reality. The hint is winning the XPRIZE seemed to be the first and easier step of what's entailed with the next process. But first, to take a step back, tricorders, you know, it's kind of like a generational thing when I say, does everybody know what a tricorder is? And you can kind of see the cutoff of you know, who knows what that is. But there is a resurgence in the Star Trek series, and there are some new films out there, and there are the new generation is growing to know and love Star Trek, just like many of us older ones did growing up. And as a background of engineering, it was kind of a prerequisite that you had to love Star Trek. And now in medicine, we'll talk a little bit about the doctors of Star Trek and the timeline. So this is the timeline of the series. And so the series was by Gene Roddenberry in the 1960s, and the first setting with Dr. McCoy and Kirk was really for 200 years in the future, in the 2160s, where you had the tricorder. And then there's been multiple series since at different time points in the fiction of the Star Trek universe. And we didn't get to an emergency medical hologram until the 2360s. So building this tricorder, we are way ahead of the curve here. So still a long way to go, though. So this is someone you guys might recognize, Charles Lindbergh, Spirit of St. Louis. Nothing to do with tricorders, but everything to do with the XPRIZE. This was the inspiration for Peter Diamandis to start the XPRIZE Foundation. Because what you might not remember is that he flew across the Atlantic from New York to Paris to win a contest. And it was back in 1927, won this contest that was the inspiration for many teams to try and do that flight. And teams, they died trying to do this contest. And that with innovation started a new industry. And just years later, we had transatlantic flights were regular and commonplace. So Peter saw this and said, hey, this is great. Let's start a contest for private space flight. And so that was the Ansari XPRIZE. That was in 2004. Burt Rutan and funded by Paul Allen, they launched Spaceship One. And so they won the first XPRIZE. And so it was inspired by the Spirit of St. Louis, and now it hangs in the Smithsonian right next to it. And so I thought that's kind of cool. And when I came in this morning from Philadelphia, I noticed that you guys have a Spirit of St. Louis hanging here in the airport, and found out that the plane was actually built here in San Diego. So that's pretty cool. And so the XPRIZE then branched out into multiple arenas, and these are some of the prizes that have been awarded since its inception. And so not just for space, but in the healthcare space, like we're talking about tonight, in cleaning up the oceans. There's many different topics that are being challenged in all these arenas. But we'll go right to the Qualcomm Tricorder XPRIZE. And so inspired by Star Trek, I'm going to show you a little quick video on an overview of what the competition was about, because it's a little bit more complicated than the Ansari XPRIZE, where you just had to launch a spaceship up. And this has a lot more elements to it.
4 billion people today on Earth don't have access to basic health care.
There's a tremendous need and shortage of physicians everywhere.
In the developing world, there's just not enough healthcare workers, or the distances are too great and the population's too dispersed.
We're still using tools that really haven't changed in decades. But now in our age of digital and mobile health, what if we could connect those together and put those in the hands of each of us, the consumer, the patient?
A lot of chronic conditions can be managed on a continuous basis if we deploy the technology.
But what we weren't seeing was a catalyst that brought everybody together to build the whole system and to make it easy for a consumer or a lightly skilled healthcare professional to use.
When you have a prize that's sort of audacious but achievable, the competition element speeds up the whole process, creates a fire.
The Qualcomm Tricorder XPRIZE. Our goal is really to bring the tricorder technology of Star Trek to life.
The doctor just waved the box over you and you knew what was going on.
Star Trek is a positive vision of the future where technology empowers man.
So the team has to be able to develop a tricorder device that is less than 5 pounds. It's able to diagnose up to 13 medical conditions, take 5 vital signs continuously, and they have a very positive user experience.
Now we're really taking the technology out of the sole possession of physicians and putting them into the hands of the community.
Tricorder will connect hospital care to home care.
We are putting your health back in your own hands.
If you're an EMT or if you're a healthcare professional or a mom, what you lack to make better decisions is data.
Most medical devices that exist today are developed for healthcare professionals, and they diagnose a specific condition, and that's it. So this is a first-to-the-world application of these devices.
This device monitors respiratory rate, blood oxygen levels,
ECG, respiration, temperature,
sleep apnea, atrial fibrillation,
anemia or Hep A,
blood pressure.
This prize is extremely challenging.
It's been a struggle. Everybody is working on their real full-time jobs, and this is still just a part-time endeavor.
We're a very small company, but yet we're a very enthusiastic team.
We've got MDs, we've got data scientists, we've got biochemists, we've got program managers.
We are a full stack company. We're a machine here. We're a machine building machines.
Teams have contributed thousands of hours of R&D and millions of dollars of funding to support their prototype development.
This is the last couple years of iterations of different designs.
We're building something that no one's ever built before.
This is our first prototype, testing software algorithms in the hospital.
The system consists of 5 subsystems.
This is our blood test system, and I will show you the blood test here.
This is a vitality necklace. This is the foundation of our platform.
These devices have to be embraced by the consumer, so we actually recruit patients as consumer testers who have one of the 13 conditions these devices are intended to diagnose.
That required a rather substantial team that included nurses, coordinators, and a variety of other clinical experts.
You can do all the simulations in the world, but having an active user throws in variables that you can never account for. And they see the result right there as they're using it, and they're like, that's awesome, where can I get one?
People will say this is where mobile healthcare started.
This project could have an impact on society as a whole.
This is going to be a wake-up call for the world.
I'm strongly motivated to see this happen. I think together we can solve this problem much easier and much faster.
These are people who are committed to global scale impact.
You feel a connection between the world that Star Trek promotes and the people that see a technology that's only suggested in Star Trek and then make it real and then make it better. If this tricorder device can save lives. What a blessing for all of us.
Live long and prosper.
It's exciting. And it inspired over 300 teams to enter the competition from around the world. And this was truly a global competition and a 5-year journey, just like the initial Star Trek mission. I think it was supposed to be 4 in the beginning. But anyway, it got to be a 5-year journey, and it still continues. And so when I say it's more complicated than the Ansari XPRIZE, it's because it really, you had to hit a lot of different things, components. So you had to monitor the vital signs continuously. You had to be able to diagnose conditions and completely autonomously. So it was well beyond the first tricorder that was on the Starship Enterprise, and it was really more akin to our Emergency Medical Hologram, where you had to not only be able to capture the data from a consumer that didn't have any medical background, capture that data reliably, but also be able to interpret it autonomously without the aid of someone looking over the shoulder of the device. And to prove that with the testing that was done here at UCSD, active trial of consumer tests. We'll talk about that in a little bit too. So this was a device that was, supposed to be able to be a demonstration project. These diagnoses varied from different body systems, infectious disease, chronic diseases like COPD, but it's a consumer device that the consumer can use. And like I said, Dr. McCoy's not around, and we don't have our hologram doc either. So we formed the team, Final Frontier Medical Devices. I think Erik made me dress up with that. But anyway, those are my 2 brothers right over here. So Gus and George. These are the only guys that would listen to me when we started the project. And so yeah, we were all engineers and tech geeks, and we loved the science fiction and were drawn to it. But we also brought some really creative ideas and different skill sets to try and get this team up and running. But it ended up that it really was a team of family and friends. But we all kind of grew up together, went our separate ways, and brought really unique skill sets to the problem. My family mainly was in the engineering side, and my friends went out and did work in user experience design and finance and healthcare policy, and really bringing all this stuff together. It seems like everyone separated after high school, did careers, and came back just to do this project. So it was pretty cool. And this is really, it is the first head-to-head medical device competition in the world, all done here at UCSD. The finalist teams had to deliver over 50 prototypes, and they were tested. And that was quite a daunting task, actually, for a little team like us. We thought when we started, oh, we could build something. And then we read the rules. And the rules said that you can really only test the tricorder on one patient, on one tester at a time. And so, yeah, that's where we almost dropped out. But there were many points where we almost imploded. But we set to work, and we started building. And there's Gus building. And then we got took over the whole house eventually for the 5 years. Building day and building at night, and got the kids involved, got them building. They really are especially talented at getting their fingers into the small spaces for the wires. But they thought it was normal to have the kitchen table covered with all these gadgets and people there doing all-nighters a couple nights a week. My one daughter would say, I don't think Uncle George moved in the last 12 hours. He's just sitting at the keyboard programming. And so we finally got to the point here where we were able to deliver some kits here to UCSD. And so that was quite a happy day. And so what did we build? So we called it DextER, which is a mashup of DX for diagnosis, T for tricorder, and then ER for the ER stuff that I do. Because really, what we built was basically trying to recreate what I do as an emergency doctor. Patients will come in, will give their symptoms, will get that information, try to understand their history of what's going on, order some tests, look at their vital signs, and really the doctor's job is to put all of that together. What part of the symptoms are valid for that diagnosis, and what are just extraneous information? That's the art of medicine, and so that's what we had to teach to the AI. And so that's what we started with. Well, when we started this challenge, we took it on really as a challenge in artificial intelligence and building that AI, starting with, based on the experience that I have as an ER doc, and that was the first round of the AI. Was basically a spreadsheet that we rolled across the floor of the kitchen and documented every element that I would find important for any of these conditions, and ranked them and coded them. That's where I got my brother George here, the programmer, and I said, "Oh, this is an AI challenge. We'll program it in a couple weekends." Right? So we took that first version of AI and we put it to the test. We did a trial from data from my home hospital, where we took actual patients that had the conditions that we were looking for and matched them with controlled patients that had similar presenting symptoms but ended up not having the condition, just to see if the AI could tease that apart. Which ones had mono, and which ones had strep throat, which ones had pneumonia, and which ones just had a viral infection. And so the AI for that first round turned out to be pretty good for things like pneumonia, and pretty bad at picking up the difference between mono and strep throat, just like your doctor. So we started there, and then we let it grow from that point with putting the AI to the test. We had physician testers that would role play. Was the next step, where we would take a physician who knows these conditions well, and we would say, you're a patient with a urinary tract infection, but you're not allowed to reveal these certain symptoms to the device, and you have to try and throw it off by presenting other symptoms to see if the AI could get back on track when it's thrown off track, when it's taken down the wrong path. Can it correct itself based on the data, all the data that comes in? And so that's another way that we let it grow before we incorporated it into the larger device and started testing real patients. So this is something that I feel really strongly about, that this AI, this is going to be part of a lot of devices that are coming out, not just what we're building. This is really going to be the wave of the future. And the importance of getting it right and getting it done stepwise in a very robust fashion, because we need to prove this technology. We need to prove it to the public. We need to prove it to the providers. And I always say the AI has to earn our trust before we really take it and start using it. The graduates from this weekend, when they're in practice, as long as I've been in practice, they're going to have AI well, let's check on the AI. What does the AI think is going on with this patient? It's going to be another tool that they're using. And they're going to say, what did those barbarians do, back 20 years ago when they didn't have these tools? Were they just making it up, as they went along? And that's the part of it that is really exciting, because that's the future that we're trying to build. The whole part of the Qualcomm Tricorder XPRIZE was a really nice demonstration project for what a system like this can do. The task now is to build it and test it and prove it so that we can get it out there where it can do some good. And so how did we actually build it? So it's basically like most designs and things. You build it, you test it, you rebuild it, you retest it, and you just keep doing that over and over again until you get something that's workable. And so this is one of our tricorder components. We call it the orb. We put it here. See, it's much smaller than the Star Trek device. But our prototypes were all built in the house. This is our battery of 3D printers, because we had to build so many components. It took a long time. And so my kids not only thought it was normal for random people to be coming into the house and doing all-nighters, but also for 3D printers to be going continuously 24/7 for 6 months straight. And so what we put together, I think, really we're able to push the envelope with a lot of not just the diagnostic engine, which I'm really proud of, but a lot of the sensors that we came up with. We tried to keep our sensors in line with the vision of non-invasive tricorder technology. Now, the tricorder from the series, you just wave it over the patient. Ours has to make physical contact with the patient, with the user, but we were able to make advancements in some non-invasive sensors, which I think are really cool, and these are the ones that we have to prove each detail about when we're going ahead and trying to get the FDA approvals for that. But we also have to keep in mind, we made a device that is simple to use. If you have a device that is very complicated, the user is not going to understand how to use it, you're not going to get reliable data, and you're not going to be able to make the diagnosis. So we kept that in mind. Here's another little clip about our team.
The Qualcomm Tricorder XPRIZE really was set up to find a way to provide anyone with the ability to diagnose diseases.
And a lot of diagnostics today are very siloed. It might be a thermometer, a blood pressure device, or a lab test. But now in our exponential age, our age of digital and connected and mobile health, what if we could connect those together and put those in the hands of each of us, the consumer, the patient, to make healthcare smarter, more actionable, and more proactive?
The era of just putting blind trust in the medical profession is over, and that's a great thing. Working in the ER is what I do. The majority of patients really are just looking for a diagnosis, looking for medical advice, people that don't have anywhere else to turn. If they had this at home, I mean, it would help 90% of the cases that come to the emergency room. The tricorder that we're developing for this competition, it's more advanced than the tricorder from the Star Trek series. This is hundreds of years in the future from what we're developing. Oh, the top buttons. Oh, nice. That's cool. And they got 3 LEDs, and we only have 2. Our team is really a family affair. Initially, it was just myself and my brother. We realized we need some broader skill sets to really get this done. My other brother is a practicing urologist and an electrical engineer, and my sister's a health policy guru, and bringing in friends that are experts in mobile technology, user experience design.
He has a vision for where this is going, and that really gives us the energy to get this to the end.
Working in the ER, it's been critical in developing this device. We have to get to a diagnosis quickly. We broke down that process
of all the diagnostic steps. We took that apart and we coded it, and that's the brain of our system. It's really the art and science of medicine mingling together. This tricorder, coming from science fiction into reality, is amazing. This is the wave of the future. There's going to be tons of these kinds of devices on the market. All of our team members have full-time jobs doing something else. So what we could scrap together on my kitchen table and in my den is what we're putting together. But don't underestimate that. We're going to get this done.
So I think what we put together is a robust system that's able to gather the vital signs, able to gather the critical data that's necessary to make an actionable diagnosis, at least in the confines of the competition. A lot of work has to go when moving forward to make this real. And we're not the only team. It's the finalist teams from around the world, the final 10 teams, all made incredible tricorders. And the tricorder might be a marriage of all of them would be the ultimate tricorder. And so this is technology that's still in the works. And part of why we're here this weekend is to meet up with some of these teams. And so these are the top 3 teams. And so we're very, very proud of that. And we got a little bit of a news flurry after that happened. And a little bump in the press. Because it's an incredible story, and people want this type of technology. People are eager to have this already out. But like I said, this is a work in progress, and it's really something that is going to take several more years to get right. So what do we do next? So we built the prototypes, we got through the XPRIZE, now what? And so this is the tough part. I had a chance to test it out on the WAS, and that was pretty cool. But what are these uses? What are the uses of this kind of device? So it was the Qualcomm Tricorder XPRIZE was geared towards consumer devices, but this type of technology can be employed in different settings. There could be industrial-sized devices, like kiosks in the center, the entrance of the hospital to help triage patients, or in population centers. There's interest in trying to get devices that are more rugged, that can be deployed out in the field, on the front line of natural disasters, in areas of conflict where you can't get the physicians out on the front line fast enough. Something you can deploy out to gather that information and be able to help make the medical decisions that are necessary to help people. And anything that we can do that's a remote or off-world use is just cool. Looking for that. So the clinical testing. And so what we've done, we've developed a roadmap of how we're going to move forward with getting the components of the tricorder tested, and so we can move towards ultimate approval. And even though the XPRIZE competition is over, it never really ends, because we're embarking on a new journey with UCSD for more clinical tests here. And so that's going to take us through these next stages that are so critical to gather real clinical level data for the FDA and to try and get these approvals to get us through the next stages. And so what's next beyond the XPRIZE? Further testing, of course, full-scale trials, improving and testing on all of our non-invasive and novel components. Each one has to be proven in its own clinical trial for the FDA to give approval. And so this marches us out a couple years into the future. But is such an exciting journey that really giving people the power of this information in their hands and with their providers is really something that's going to change the face of medicine. And so that's where we're moving forward with the testing, getting the hardware even smaller, expanding the amount of diagnoses, and really moving that ball forward. And that's the mission of XPRIZE, making the impossible possible, which is really exciting. Thank you, guys.
For our first panel, we'd like to talk about what happened here at UCSD testing the tricorders. We will include two doctors that you've already met, Dr. Harris and Dr. Viirre, but we're going to add a family doctor, Dr. Rusty Kallenberg, who can take the stage. Oh, he's taking the stage. There you go.
Beamed over.
He's snuck. He's very sneaky. UCSD Family Medicine has dozens of doctors, thousands of patients, and trains doctors all the way through medical school until the completion of their training and their launch into medical practice. Family medicine has a special emphasis on being doctors who you reach out to first, who know your problems and your needs, and they have the empathy to understand how a health issue affects a patient's life. Family doctors do all kinds of treatments. They decide who might need to go on and see a specialist. Dr. Rusty Kallenberg is the chairman of UCSD Family Medicine Program. He sees plenty of patients himself, but he also works with the large faculty of his department to ensure quality care is given and that hundreds of medical students and medical graduates get essential skills and knowledge to look after people. Dr. Kallenberg was the program director of the Tricorder XPRIZE Test Program from 2013 to 2017. Ladies and gentlemen, let's have a hand for our panel. Now, I'm going to start, Dr. Kallenberg, or Rusty, if I may, with you. Can you tell us how you got involved with the Tricorder Test Program? What made you decide to join?
Well, it was a fateful meeting with Dr. Viirre here. I had known Erik for a number of years. We call him our dizzy doctor because he takes care of all of our patients with disequilibrium and vertigo and dizziness and tinnitus, ear ringing, and all kinds of difficult, challenging problems that are usually or frequently require a specialist for additional evaluation. I didn't really know that he was a secret science kind of guy as well, and now I refer to him as our mad scientist. But he asked me to chat at a Whole Foods in La Jolla one day after work. Typical, our primary jobs are usually pretty full-time, so this was at like 5:30 or 6 o'clock outside of Whole Foods, and said, I'm working on this XPRIZE thing. We're trying to make a tricorder. Well, I'm a fan of Voyager and Star Trek and Next Generation and all of them, and so this was immediately interesting to me. And the proposition was that we needed to sort of be able to find patients to test tricorders. And I'm a big fan of our electronic medical record, EPIC here. Our division, my office was the first office that used EPIC at UCSD about 10, 11 years ago. And so I'm a fan of this kind of technology and its use in practice. And I said, we could do that. And that was it. I was in, and there was no turning back. And we're now involved in version 2.0. And the same team that we assembled, I picked a couple of other docs in our division and another very smart guy in the general internal medicine division, another primary care outfit at UCSD. And we have been the physician oversight committee for the Tricorder XPRIZE since that time.
And tell us a little about how the tricorders were tested here.
Yeah, this was as Basil said, you know, putting somebody into space, it's pretty easy. You know, you just have to build a rocket, and you know, if it fails, you build it again, and you figure it out. But dealing with humans is very messy, and the project was essentially kind of a sensitivity analysis initially. We needed to pick patients who had certain conditions, allow them to use the tricorders, and we did this at the CTRI Center here, Center for Translational Research, and allow them to interact with the tricorder with just a minimal amount of additional or initial education, and then see if the tricorder could get the right answer, you know, could make the right diagnosis. So we had to find patients with 12 or 13 different conditions, and this is where our EMR really helped out, because we have probably about 150, 170,000 discrete patients seen at UCSD every year. And so because EPIC has grown and it encompasses our entire medical center, we're able to have data on all 175,000 of those people. So we were able to find patients with certain illnesses, concentrate on them for a few weeks or a few months, and then ask them to participate. And what was a remarkable component of this was how willing patients were to participate. I almost never got turned down on the phone when asking a patient to participate in this. And maybe it's San Diego, maybe it's the high-tech world we live in, but everybody was very gracious and very interested in helping to have a hand in developing the next generation of technology. And so we would invite them to come. They would come into the center. We had some very excellent research assistants working on the program who actually have told me since then that working on our project was one of the best things they've ever done in their research career, and I just think that demonstrates the infectious interest that you know, involves this project. And so we would then test them. It would be about a 2.5-hour process, a little bit of education, interacting with the tricorder, just as Basil showed in the film, and then doing some post-testing, sort of how was that? You know what I mean? How did you like that? How did your interaction with the tricorder go? And then we gave them monetary compensation, valuing their time and effort to come and work with us, and that's what we did. That's how we did it. And we had to develop lots of ways to find patients, using the EMR and using some other shifty ideas and connections with our specialists and with different clinics in order to identify the patients, because some of the conditions were sort of perishable. You know, if you have a urinary tract infection, we usually try and cure you within 24 hours. So we have to get you when you're symptomatic and get you and the tricorder together so that we can do the testing that needs to be done. So that's sort of a brief overview of what we did.
Working with the tricorders, I'm sure there were some surprises. Could you maybe share with us a really good surprise and maybe a not so good surprise?
Well, let's see. I think the not so good surprise would be when the tricorder would come up with a false positive diagnosis. This is always a challenge with every technology we develop. Even AI physicians actually can come up with the wrong answer.
Well, not all.
Not this AI physician. Some of the more rudimentary versions we built. So when a patient would have a false positive, something sort of delicate like HIV, you know, that would, you know, there were plenty of warnings ahead of time that these were experimental devices. They could come up with things that are wrong. They could miss things that are right, you know, and so, but we had to be on the phone with them immediately and be able to communicate with them and say, we're going to do the gold standard test on you and make sure that you don't have HIV, and we want to make sure that we'll be with you until we've nailed this to the end and sort of taken care of them. And so that was sort of a you know, a negative, you know, kind of thing. I think the positive thing, just in general, was as I said, how positively disposed to sort of participating people were. People frequently signed up, said, "Can I do another? Can I do some more?" And there were some people we brought back. We were only able to do 3 maximum, I think, for a particular patient. But there were patients who we brought back for 3 times, and they enjoyed every one. And they were testing a different tricorder each time, and they enjoyed that immensely. And I thought that was one of the most sustaining things that I interacted with. We had patients who responded electronically that they were interested, and this shows you the length of development to be able to apply these instruments universally. And I was talking to a patient one day, and they sounded very interested, and then they said, "By the way, I just have to tell you that I'm blind." And I said, oh, we don't actually have a tricorder model that will actually work with blind people yet. I'm so sorry, I apologize. And he was very gracious about it, and I just realized, boy, we do have a long way to go to make a version of the tricorder that will work on someone who can't see. So that was, the patient response was one of the biggest positives about the whole thing.
We saw, obviously, in the videos how tricorders will make a difference in the future medical care. Do you have something you'd like to add about how you think that they might make such a difference?
Yeah, we are constantly in communication with our patients, and now that we have web portals like MyChart in our Epic thing, I mean, I'm talking to patients at midnight, and so anything that can empower the patient to have more intelligence in our communications, more awareness of their condition, more accuracy about their condition, more measurements about their condition, makes the communication so much more of a quality interchange and a learning experience for the patient, a learning experience for the doctor. We're about to initiate video conferencing with our patients so we can actually do virtual visits with them over MyChart and over our EMR. And so this just makes care more convenient, more cost-effective. Why come in and spend 3 hours parking and doing and all that kind of stuff when I can just talk with you? And if I know you real well, I can put your symptoms in context, and if I need to see something, I need a measurement, tricorders will be able to give me that right there, just like you were in the office. So I see this as tremendously beneficial, even in an urban area like San Diego, let alone a remote developing country where there ain't no primary care physician within 50 miles, and you've got the tricorder to stand in for Basil and I.
I suppose my last question to you is a physician heal thyself question. Would you personally trust a tricorder diagnosis?
It depends on the tricorder. I think I would trust the final frontier equipment. And we have that problem right now. We have patients who call in and say, my blood pressure's off, and I said, okay, tell me a little bit about your blood pressure cuff. Well, they say, well, it's on my index finger. No, we're not trusting that blood pressure. But if they have a certain brand and they use it on their arm and they did it appropriately, then we know. So when we get to Tricorder 6.0 and it's done by Final Frontier, then we will know that it's a valid instrument, and we will trust it.
How about you? How about the audience? We'll ask that question. If you had a smart doctor device, an app on your phone, how many of you right now would trust the diagnosis of a smart doctor on your phone? Good. I have a few things I'd like to sell you then. I was wondering if it was going to be 2 or 3 or 5 years out, but that many of you, it looked like about a third of the audience, would trust a smart doctor app on your phone right now. That's exciting. I'm going to move on now to, oh, wait a minute. There's one final question that's completely self-aggrandizing, so of course I have to ask it. I understand that you enjoy science fiction and Star Trek. Do you have a particular Star Trek episode or scene or character that is memorable? And it doesn't have to include my character.
Well, I mean, gee, should I be politic or honest?
I think I prefer politics.
Politic, okay, all right. Then it's a race between Data and our emergency hologram doctor always, and I'm sure you had that conversation a couple days ago with Brent Spinner. But I think that my favorite holographic emergency medical physician episode was when you finally were able to leave sickbay, and you had your portable, holographic projector, and you were able to visit the rest of the ship. That was a very liberating moment.
Exactly, especially since doctors don't make house calls anymore.
That's right.
It seems so odd that I would be doing one 200, 300 years in the future.
There we go.
Let's move on to Erik. Can you briefly, what is the XPRIZE? We all know what the first XPRIZE was. We've talked today about what the Star Trek Tricorder XPRIZE, but what is the XPRIZE really in general?
Well, Basil gave a great overview with the inspiration by Peter Diamandis of Charles Lindbergh. And the idea is, how do we create incentives? So how do you win the Nobel Prize? Well, you invent something and then you wait 20 years generally, and if you're still alive, you get to win the Nobel Prize. But that's a long, drawn-out process, and so there are certain things that we think might be important, and in fact, XPRIZE has a whole process around this called visioneering, where they try to come up with ideas that are important. What will we do? Where's the missing link? So lots of things, so for example, we've had an idea of a prize for Alzheimer's disease. Well, the prize for Alzheimer's disease is fixing Alzheimer's disease. We don't need a prize for that. We were talking earlier about the genomics prize and how we could have an inexpensive genome. And in fact, a prize was set up for that. And things happened so fast, faster than Moore's law for silicone. The Moore's law for genomes was even faster. And so sort of superseded the XPRIZE that was set up for genomics. So it's trying to find this sweet spot. What's an interesting and what's an important thing that we need to see in the future? And in this world, we have lots of different things that are important. Some of them are too far out there. I don't think we're going to have the warp speed XPRIZE yet, although we're working on it. A transporter, yes. Although there was the Transporter XPRIZE, and that was for autonomous drones that would carry people. And those are coming. They're coming. They're being built and flown right now. So it's actually really a fun process to find out what XPRIZes could be important. Where's the gap? There's something that, oh, that's an obvious business, or this is an obvious scientific achievement, but there's something out there in the middle, and the tricorder was a perfect example of that. A system that put all the different pieces together, and could we show that that was even possible? And here's our guy that did it. He showed that it was possible.
And the Tricorder XPRIZE really, where did it originate, the idea? Where did it really get started?
Well, that's a fun story too. So, and of course, involved Star Trek geeks. We saw Paul Jacobs, the executive chairman and previously the CEO of Qualcomm. And Paul was a Trek geek in his youth, like Basil and I were. And so Peter Diamandis, as you know, loves Star Trek as well, and came up with this idea he was going to have a medical AI competition. And they were so a big thing about a prize is to have sponsors. So when we have to have a sponsor who will put up the prize purse, so they said, well, you should talk to Paul Jacobs. But the key to talking to Paul Jacobs is say tricorder. So he went in, he said tricorder, done. So.
Well, that works with me too.
Yep.
And what did you personally want to see happen working on the Tricorder Prize?
Well, so again, being a Star Trek geek, I wanted to be on a panel with an emergency medical hologram, so that was really fun. Yes. And in fact, Basil's part of this story as well, which is make the word tricorder part of the parlance. So in fact, part of the things we do in XPRIZE is come up with important ideas. We were talking earlier today about the idea of miles per gallon equivalent. That was from the automotive XPRIZE for fuel efficiency. If you don't have gallons of gas in your electric car, how do you compare that car to a gasoline-fueled car? You have a formula, and in fact, the formula that you now see on the window sticker if you buy an electric car was invented by XPRIZE. So I wanted our XPRIZE to make tricorder a word of the parlance, that now not just Star Trek geeks, but everybody would be looking for tricorders. So 2012, we had the first team summit here, I think. Is that right, Basil? We had the 30 teams that were interested in competing and came to learn more about the rules that I was making up as we went along. And so I had a challenge. I wanted to see who was really good out there. And I guess it was propitious because I said, and don't answer this yet, we'll see, we'll test them. So who knows what the tri of tricorder stands for? Tri is 3. Anybody out there? Well, my panel colleague here knew the answer, so tell us.
Sure. So the tricorder has had 3 states of being, of devices. So there's the medical tricorder, which is what this competition was all about. But there is also meteorological tricorder and a engineering tricorder. And so these three different types of tricorders were what this general purpose computer and sensor was in the Star Trek world.
So show them your prize. What did you get for
and
knowing
this
the
is what I
answer to
got.
that?
This is what I got back then.
That's
I got
right.
This pin.
So we should have known. We could have just forgotten the whole thing. We could have just had. We should have just kept all the money and done the thing right then, there, Basil. We wouldn't have had to run the whole competition. We knew you were going to win right there. So I came in with my replica tricorder. He knew the answer, and we were all ready to go.
And please do not ask me any Star Trek, what do you call it? Do not quiz me. No trivia.
Galaxy
no
quiz.
Special. I mean, I literally thought the pon farr was a Thai noodle dish. So don't quiz me on my Star Trek lore, please.
What's the name of your character?
Well, I had many names, but the Emergency Medical Hologram, that I remember. And now what happens next? I mean, I know that this weekend is the beginning of what happens next, that the prize has been won.
Right, so we're super excited that Basil is here with his team members and our colleagues throughout the university. I see Dr. Rao out there, who we're going to hear from shortly, is helping us build the data cloud that our engineering colleague Phil Rios helped build. We're going to build a system that these tricorders can talk to Epic with, so that our tricorder competitors will now come right into your medical record system. So we're going to have a engineering background for that, so that we can do the tests right here at UCSD and the follow-on that Dr. Kallenberg was just telling us about. We'll also be sitting down with the teams, with business experts, trying to find out what's the best business strategy now. And we are including our colleagues from the business school and collaborating with these teams. So we're really excited to go from this demonstration to something that really will be government approved that you will have in your home.
Finally, a philosophical question. Are you Kirk or Spock?
Well, that's such a hard one, because I really respect Mr. Spock's intelligence, but I always wanted to be Captain Kirk. So.
And now a trick question. Who is your favorite Star Trek doctor?
Who is my... Well, that's a hard question.
All right, we're going to move on. All right, now, Dr. Harris, we've heard your story about the winning team. Very exciting, especially since you're from Philadelphia. But now on to more important things. Who is your favorite Star Trek doctor? No, I'm kidding. No, I'm kidding. Unless you want to answer that. You don't want to answer that. Okay. Can you tell us a little about working with UCSD on the Tricorder program?
Sure. I mean, so we had to build many devices and send them off into the world, into the very capable hands of Rusty here and his team. But it's kind of like sending your kids off to college. You know, you spend and you toil over building them. I think we ended up building 65 tricorder units to send off. And you took very good care of them. But, you know, it's and running tests at my hospital as well in Philadelphia. I know the challenges of it, and I appreciate, you know, all the hard work it is to do it. But every step of the way, you guys did an incredible job. From, you know, we weren't involved in the actual day-to-day testing. Just the calls for, hey, send more kits.
That's a good sign.
So, but it's been an incredible process, and I'm really looking forward to continuing the testing here at UCSD with the next generation. We're not quite up to the version 6 that you're going to use it, but
we'll take it one digit at a time. You know.
We're getting there.
And how has winning the Tricorder XPRIZE changed your life and the life of your teammates?
It was really an incredible journey. We never really expected to win when we started this competition. You know, it was basically a fun project that we could all get together and work on. I would tell the team for the first few years, if we made it to the top 10, that would be our victory. I mean, that would be incredible. Then we made it to the top 10, and I said, well, we got to keep going. You know, we can't stop now. But it was a long, long journey. 5 years is a long time to have all this stuff spread around the house. So now the kitchen table's cleaned off, and the kids, we have a place to eat dinner. But it's not really over. And so now, even though I've cleaned it out of the main living areas of the house, there's still little corners where there's piles and piles of stuff and tricorder parts, and we're still designing, we're still building, and we're working on that next generation. And that's what we're going to start testing soon.
Do you think this experience with your family has influenced your children as to what they want to do with their lives?
Or what they don't want to do. You know, so
they want to have a dinner table that they actually eat at.
Yeah, so time will tell to see how it's going to influence them, but definitely has given them experiences I wish I would have been able to have. I took my one daughter to Geneva, where we participated in the AI for Good conference that was co-sponsored by XPRIZE. And so she got to present there with in the meeting space, not on the panels. It was international panels. They just had their second conference in discussions of how to use artificial intelligence for good in the world, and how to design these systems so that they're used for good purposes. So it's really cool.
I would have thought your kids would totally ace the science prize, right? Did they steal any of your little technology tidbits and submit them as their own? And,
no, but we did use some components from competitions or some science projects. My one daughter wanted to figure out whether girls or boys were more susceptible to being scared by scary movies. So she brought a bunch of friends over, and we wired them all up and showed them scary scenes from scary movies to see whose heart rate would jump. And much to her delight, I don't know if she tweaked the data, but the girls were a little more robust.
All right, I believe that. Now, before we turn it over for a couple of audience questions, I want to ask you in front of this group of people, can you confidently tell this audience that mobile health systems will really be able to help in the future in medical care? Because we're recording this.
Absolutely. This is the beginning of the new era. And like I said earlier, the graduates from this weekend, when they're out in practice, this type of technology is going to be permeating through a lot of the devices that they are going to use on a day-to-day basis. Now, Rusty is already, wants to gather data on patients from the home. And I could tell you from experience in the emergency room, in the emergency department, there are a lot of patients that get referred in that could be cared for elsewhere if their treating physician had the information, and if they had the information, and that connection could be made. Imagine you're fielding a call from, and you're in charge of a pediatric practice, and you have to care for 300 or 500 patients. You're taking calls all night long. If you had a reliable stream of data from the home of that child, it would be much more impactful than just even a video chat. If you had their vital signs, you had a stream of their white cell count, some basic lab information, you'd be able to make that decision and say, hey, it's okay, we'll see the child tomorrow in the office, rather than go to the ER right now. I mean, so this is it's gonna change medical practice.
Now I'd like to just ask you, perhaps for 2 or 3 questions from the audience. You could direct it in general or to any of the panelists specifically.
You
All right.
Take the microphone and
all right.
Is it the burden of your team to actually create the technology for each of the non-invasive testing when my perception is there's lots of companies working on non-invasive testing of each of those kinds of things. And I would think the challenge that you would want, there's the challenge of integrating all that into one, but to actually also create the technology for each of those, that sounds like an overwhelming task versus all these other people who are already working on like non-invasive glucose testing.
Sure, that's a good question, because there's a lot of the technologies that we put into the tricorder for competition that are not new. Yeah, so we know how to take a blood pressure, we know how to read an EKG, so we didn't reinvent those. We did try to push the envelope for more non-invasive tests where we could get estimates on hemoglobin, white cell count, glucose without drawing any blood, and try to push that reliability. I don't want to overstate what it can do. It's not to the reliability level where you could dose your insulin based on its value, but something that's telling you, hey, you're going out of range, you're getting too high, do the follow-up test. That's the goals that we have right now, and this next generation that we'll be testing should be promising. So.
The next question, I don't see where the microphone is.
Patrick's.
Since this is meant to be a consumer device that people will have in their homes, do you think this might affect like people who want to self-medicate? Like, okay, forget the hospital, forget the MD. I have this machine now.
Sure. You want to take that one?
Yeah, no, I mean, I think that the benefit is to sort of understand the difference between symptoms that could mean something very serious and symptoms that mean something that needs just symptomatic, treatment. So I would think that part of the AI build would be that, we think that this is a self-limited upper respiratory infection, and therefore you can take the following range of things that you can find over the counter at your local pharmacy, or things that you can do at home in terms of, hot drinks or whatever, that kind of thing. So I think that would be the range of self-medication that would follow on the fact that this is a self-limited diagnosis and does not need further evaluation by a non-holographic medical physician.
All right, we need a woman question. We need a question from a woman, and it shouldn't be the front row. We want to be fair.
How did you decide on these particular 13 maladies, and in your next iterations, will you expand? I mean, that book of pharmaceuticals is, 5 inches thick, so how did you decide?
Well, I have to take the blame for that. So we had a series of projects where we took a look at what we wanted to do as a demonstration. So the point was that we didn't want to have a whole bunch of the similar kinds of things. We wanted to show the range of possibilities. I remember we had a meeting once with the sleep doctors, and they said, our sleep machines can measure that. Yeah, but can they measure pneumonia? And it's like, no. So the idea was this range of conditions, including things serious like strokes and even cancer. And the cancer we thought about was melanoma, because that would be a cancer that you could see, and then it would be removed and verified right away. So the idea, as we were saying before, is to demonstrate this whole list of conditions. Now that's a little different, or not a little different, very, very different than what is going to be a good project for business. In fact, one of our competitors decided that they were so busy building these things that they wanted to build a post-heart attack tricorder. Now, I thought that was a pretty great idea, actually. So a tricorder that you take home from the hospital once you've been in an emergency and follow you up after you've had a heart attack. So the trick now, and each team will come to us and tell us what they're interested in, is the sort of things that, range of problems that they're interested in. So, for example, infectious diseases or lung diseases, or a general medical care kind of thing, which is the big, big problem. But as you point out, there are 10,000 human diseases and even a few alien ones out there that that copper-based green blood is a problem, So the green LED has trouble with it. So we will we have to pick and choose, but ultimately we want a tricorder that can do everything. Yeah.
I'm allowed to ask a question, right? I've got a microphone. On Star Trek, we were famous for doing episodes about ethics and often about medical ethics. I can recall specifically 2 Voyager episodes. One of them, there was a medical discovery that had been made through torturing people. And the question was, does that taint the discovery itself? Could you use a discovery that would save thousands of lives if it had been discovered at the expense of taking thousands of lives? Another one, we did an episode where we met, that my character was hijacked onto a spaceship and forced to work in medical care, and the spaceship had several levels, like it was like the circles of hell and the inferno, different levels of medical care that you were assigned medical care according to your perceived worth to that society. If you had a very high level job, you got A-list care all the way down, which was an obvious metaphor for issues in our healthcare system. So my question is, what are some of the ethical issues that are involved with the tricorder as you bring it to market?
Well, I'll take that one. Because the answer is that in no way would we take information that was not ethically arrived at. First of all, it probably tainted information in the first place. It probably is unreliable and not meaningful. And furthermore, we would never be able to countenance that kind of acquisition of information. And in fact, our first principle of our competition was safety. So we had an extensive review process. My colleagues who helped us inspect the tricorders to make sure that they were safe are right here in the audience. One of them is here with me. We had an international panel of judges. And most importantly, we had oversight by what in the parlance is called the IRB, the Institutional Review Board. And so we weren't doing science, so we weren't doing a clinical trial. And in fact, I agonized a long time about that and ultimately went and convinced the FDA at the FDA offices that we were not doing a science research study, we were doing a competition. But that still meant that we had to have ethical oversight. And so, as I say, in no way would we ever accept information that was collected in an unethical manner.
And for example, the medical privacy issues that involve transmitting specific data about patients' condition via the internet.
So my colleague Phil over here was in charge of the data cloud, and we were very fortunate to have Amazon Web Services provide web services for us to store the competition information from the tricorders, but they had to comply with the HIPAA compliance, the Healthcare Portability Accountability Act, so that we were conforming to proper healthcare standards. And my colleague out in the audience can tell us that in some ways, the good news is that the medical community is a leader in data security and privacy and ensuring things like you can't back calculate who that person was. We were very careful about information and its constructs, and there are very serious consequences for privacy breaches, and all the time we are working that higher and higher and with stiffer and stiffer standards and fines. It's a problem and a pain for us as physicians often in the practice, but on the other hand, we respect the data security.
All right, we'll take, before our second panel, we'll take one more question for this panel for someone who really, really wants to ask a question. I think that gentleman does.
Were any of the sensors wearables? In other words, that you just leave on all the time? And if so, or if that's going to be one of the components, and you're always sending data to a cloud, an anonymized, secure cloud, how is that going to impact the physician? Because now you're responsible for monitoring the patients 24/7. And what if you get an alert, it's a trend or not a trend?
Yeah, that's good. And there's, you could take it too, but yeah, for the competition, there were phases where you would have to either monitor the patient in a few hour session, or the patient or the tester would actually take the kit home and wear it, continuously gathering data for 24 hours or more. with continuous streams of data. And so, yeah, there were wearables that you had to incorporate into the device. For Basil Leaf Technologies, we're actually moving a little bit away from the wearables, and we're now in doing just kind of spot checks of vital signs. But there's a big market for wearables and that continuous type of data streams. It does bring up those challenges. If you have an interruption in that stream, or you have a noise in the stream, how do you decide is during that uncontrolled session? Is it just that the patient dove into a swimming pool? Is it the patient is doing aerobics? You have to be able to decipher that data stream if you have the continuous type of data. So.
And the healthcare team monitoring, obviously has to be established accordingly. I mean, we do a lot of home, recordings now, Holter monitors and, continuous oxygen, readouts and things like that. And so it's done in the context of the whole care of the patient, depending upon if something goes wrong, who can you call immediately, or how is the information transmitted immediately? Are there warning systems, and things like that. So I think those systems have probably been pretty well developed already for especially cardiac monitoring, when people are having extended event monitors, because they have an episode of fainting and we're trying to find out what that's about. So I think those companies have probably figured a lot of that information out, because a lot of those companies have technicians that you can call. They're watching everybody all the time who are on those event monitors.
Well, this is another spot for AI to take over some of those roles a little bit more robustly in some situations, yeah.
And as the only AI on the panel, I am taking over, and I'm declaring this panel finished. Thank you so much.